for wrap-up, and thank you again for filling in for me.
Absolutely, Chair Murray, and thanks to the witnesses. This has been a really good hearing. I want to stick right where Senator Rosen was at the end of her questioning about workforce issues, and particularly workforce in helping folks with substance use disorders. My experience has been, and I wonder if this is more than anecdotal, is that some very effective folks in this workforce are people who've had substance use disorders themselves. But I also find, as I travel around Virginia and talk to people, that they, and how legit this is or whether it's a perception, they still feel like if they've had a substance use disorder, particularly if that's led to any criminal conviction, that they can be challenged in licensure, and regulations often get in their way in terms of being able to be in the workforce. They can volunteer, they can be part of a support group, but if they want to make it a profession and help others because with using the experience that they've gone through, there can be barriers in their way. So I wonder if you might talk about that, because if we are looking for a bigger workforce, we wouldn't want to keep out of the workforce people who've had a life experience that would make them particularly effective.
I'm happy to comment on that. I mean, we have absolutely seen that individuals in recovery, so peer support specialists, recovery support specialists, make a meaningful difference in terms of connecting people to care and giving people hope. Often we find recovery coaches share their own stories of lived experience and often are able to help connect people to services and supports. In fact, we've seen with our state opioid response grant, many states now have programs where they have recovery coaches connecting with emergency departments. So when an individual is brought to an emergency department, they're linked up with a recovery coach, and then the recovery coach helps with system navigation, helps them get connected to care, or helps them with whatever they need. Often they say their first question is, how can I help you in your recovery today? So those programs make a difference. We've seen recovery coaches also in working in methadone programs, working in supported employment programs, and it's an area in terms of SAMHSA that's a priority for us in terms of expanding our recovery work, and we recently announced a recovery Office of Recovery. Recovery is also one of the pillars of the HHS overdose prevention strategy as well.
I would just add, if you don't mind, sorry. Peers, people with lived experience, are part of the solution here, and we are not going to succeed in the way that we want to in combating the opioid epidemic, combating the substance use disorder challenges without engaging people who have lived experience. They have the unique ability to connect people to care, and we want to support that. The licensure issue that you raise, I suspect, is a state-by-state issue. In my prior to this role, I was the Human Services Commissioner in New Jersey. We didn't experience that issue there, but I will commit to you, if you are seeing that in other places, Miriam and I want to be vocal and help address those issues, because we want peers to be part of the solution.
Excellent. A related topic that I want to ask about is folks who are incarcerated. So 2 million people in the United States, 25,000 in Virginia. Of this population, about 2/3 have a substance use disorder history, often a current challenge. And about 1/4 of those have opioid use disorders. The data shows that folks who receive treatment, including medication-assisted treatment, are more likely to engage in post-release treatment and to stay in treatment longer. There's challenges with medication-assisted treatment in prisons and jails. What might we do to enable people to get this kind of treatment that's going to help them while they're incarcerated, but more particularly when they're no longer incarcerated?
Mm-hmm. Yeah, thank you for that question. Such an important area that individuals who are connected to the justice system get connected to services and supports. So SAMHSA has our drug court initiative and grants, which help to divert individuals from further involvement and connection with the justice system and into behavioral health treatment. Individuals are then able to get connected to medication-assisted treatment or other services and supports that they need. So that's one initiative. I think diversion programs really make a difference in terms of connecting people to care, but also in-reach programs. So programs that connect people to services and supports pre-release. And those programs can help to ensure.
How about particularly the issue of medication-assisted treatment for those who are incarcerated?
Yeah. So we are supporting a number of prisons and providing technical assistance around administering buprenorphine or other forms of MAT within criminal justice settings. So we have done some technical assistance there, and so that's an important area as well, so that for individuals that are in prison, for them to get connected to MAT as well.
I have one last question that I want to raise. The committee was very helpful in getting a bill passed that President Biden signed last week called the Lauren and Breen Healthcare Provider Protection Act, which was to try to provide mental health assistance to our frontline healthcare workers who've had a lot of challenges even before COVID and then particularly since COVID. And as I was thinking about that bill and talking with the Breen family when we were at the bill signing last Friday, I started to think about other parts of our workforce who have really had challenges during COVID. And a friend of mine said, what about last responders? And I said, tell me, I haven't heard that phrase. What do you mean by that? And talking about people who work in nursing homes and long-term care facilities where the illness and death tolls have been extremely high. Often these workers are paid very little. These are some of the lowest paid workers in our system, and yet they've seen and experienced themselves. Many of them have gotten sick and died too. What have you seen with our long-term care workforce in COVID, and how might we approach this issue of mental health resources for them?
Well, I would say thank you, Senator, for your leadership on this issue, and to the chair as well. We were, with American Rescue Plan resources, able to do $103 million in awards to 45 grantees to support healthcare provider resilience and help reduce burnout. As part of that, one of those awardees is a technical assistance center, which we're hoping to leverage all the learnings from this work so that it's not just the 44 grantees and the technical assistance center that get the benefit of those resources, but that we can help healthcare providers across the country in addressing this issue. But you raise a very important point about frontline long-term care workers who have been heroes throughout the pandemic, and I look forward to working with you on ways that we can address their mental health needs going forward.
Great. Thank you. Thank you, Chair Murray.
Thank you. Very, very good point. That concludes our hearing today, and I want to thank all of our colleagues and all of our witnesses.